Hi, I'm HJ. I'm a female veteran and a senior psychotherapist here at Combat Stress. Today, on International Women's Day, we want to focus on the often overlooked women of the armed forces and veteran population, and the support that we can offer you here at Combat Stress. Over 11% of the armed forces population in the UK is made up of women. Yet women veterans can often feel overshadowed by their male colleagues, and this is often due to media coverage. Here at Combat Stress, we support veterans who, because of their military service, have complex mental health difficulties. Over 10% of women leaving the armed forces report post-traumatic stress symptoms, in comparison to 7% of men. Women have long been able to serve in frontline roles. More recently, this has extended to ground combat roles, including the Royal Marines. Yet we know that your military trauma doesn't always relate to war zones or combat environments. In fact, we've listened to the lived experiences of our women veterans, and we understand that your military trauma may be due to exposure in support roles, such as medical and nursing roles. This has most recently been tested during Operation Rescript and the COVID-19 pandemic. Peacekeeping operations, where in some cultures women respond better to women, putting you at the forefront of mission objectives. Humanitarian roles, such as Op Rock, where you were exposed to famine, disease, and death. And your experience as a woman in the armed forces, which may mean that you're exposed to emotional trauma, trauma related to bullying, harassment, medical downgrade, or military sexual trauma. Additionally, women leaving the armed forces have reported that the transition process is often male-centric by design, leaving them feeling less supported for that transition back to Civvy Street. Here at Combat Stress, we want you to know that you're not alone, and we're here to support you. Follow our next video to see what's available at Combat Stress for women veterans.